that's.
No.
All right, we'll get started on our final presentation in this room today. Dr. Joseph Sharlow, which really needs no introduction. I've been around here for 25 years now, quite a long time, but you've got something very exciting to tell us about today.
Right. We're going to spend a few minutes talking about a new innovative procedure that's offered by Genesis Med Spa right now, and it's called the Mona Lisa Touch. Now, the Mona Lisa Touch is an innovative laser procedure that addresses vaginal health. And I know oftentimes it's something people are embarrassed to talk about to the family, their loved one, or even to their physicians. This is something that most, not I'm going to say most, but 50% of 64 million women who are in their postmenopausal stage right now suffer from, and that's vaginal atrophy. Basically a loss of good vaginal health, where you deal with problems of vaginal dryness, painful intercourse, increased urinary tract infections. You know, you're using creams, you're using things just to make things work right. This is all a consequence of the loss of estrogen, and it's normal in the aging process. It also occurs abnormally sometimes when you have to receive hormonal therapy. If you were unfortunate enough to have breast cancer, even at a young age, where you can no longer take estrogen. If you've had a hysterectomy and you've lost your ovaries. All of these things can lead to premature loss of estrogen, but again, as I mentioned, the majority of people lose estrogen as a consequence of the aging process. And all of us age, unfortunately. There's no way to avoid that. Now, the Mona Lisa Touch is an office procedure. It's minimally invasive, and it virtually has no side effects, other than a little discomfort that you may experience initially for a couple of days thereafter. Long-lasting effect that is clinically proven by now more than 17 studies, clinical studies that show that this works. This procedure is done by female medical professionals. Patty is my registered nurse that does the procedure. Mary Casilius, who is not here with us today, is a registered nurse practitioner, also doing the procedure. And actually, Dr. Breckenridge will also be doing this procedure. It's fractional CO2 laser therapy. Carbon dioxide is a form of laser that has been around for many, many years. We've used this type of laser around the face. I mean, it's been used in numerous areas. It's a very safe laser, time proven. But when we administer it for what we're using, it's a lot less than what we'll use in the face, and it's very gentle. Women have been treated since 2012 with this, when the first clinical studies began. And if you look on the internet, you'll find that most of the clinical studies here in the United States began in 2014. Right now, if you look at the numbers, there's probably over 100,000 women that have been treated with this procedure, very successful, with no side effects. The laser that we're using actually was made by DECA in Italy, and I have to give DECA the credit for the company that developed this laser. There are other lasers that still offer CO2, but the Mona Lisa Touch is the one made by Cynosure that has clinical studies to prove it. So we go on to the next one. Patients who suffer from vaginal dryness, patients who suffer from increased amount of urinary tract infections as a consequence of this, and patients who have no longer who are no longer able to receive estrogen therapy because of breast cancer or because of their increased risk for breast cancer, are all candidates for this procedure. One of the interesting benefit of this procedure as well is that if you suffer from mild urinary stress incontinence, this will also help that. Because of the urogenital lining, this improves, the strength of the tissue, and urinary incontinence is markedly improved. This is not a surgical correction for people who have moderate to severe incontinence, but mild stress incontinence that women will get from vaginal atrophy, the loss of healthy vaginal tissue, or women who've had babies. The procedure is administered with the use of a laser that we do use following a good gynecologic examination, so we do ask that you have seen your gynecologist, and we know that you're healthy enough to have this done. There are some contraindications or times when it's not safe to use, and we would make you aware of that, so we make sure that it's very safe for you to do. The procedure itself takes about 5 minutes, maybe up to 10 minutes. The people who have the procedure will say that the pain associated, we don't give pain medication because on a scale of 1 to 10, I've heard described a 2 to 3. You feel a gentle vibration while it's being administered, and it's a very quick procedure. 6 weeks later, you have another procedure. 6 weeks later, you have another procedure. You pay essentially for 3 procedures because that's what we recommend, because that's the number of procedures that have been shown clinically to provide you with the results that you're coming to receive. Any additional procedures that you have to have done is included with the first 3 procedures that you need, and most of the time it may be only 1 procedure. We recommend that you consider a repeat treatment 12 to 18 months. Now, the time period, how that is decided, is basically on what you experience. So some of the comments that you'll hear from people who have had this treatment done will find that no more dryness, no more need for estrogen creams. Sexual intercourse is no longer painful as it was before because now you have healthier vaginal tissue that self-lubricates like it should and like it used to. And also the benefit of having less problems with urinary incontinence. Most people will note some improvement after the first treatment, but certainly after an additional treatment, and that's why we recommend go through your full 3 treatments. The way the laser works, and I'll just give you a little clinical background on it so that you understand it's not a magical thing. The way the laser works is that when the laser is inside the vaginal region, it emits CO2 laser energy gently to the side walls of the vaginal wall, okay? That laser induces the growth of collagen because it causes a minor injury. The minor injury that it causes is pinpoint. It's no larger than maybe hair that you have in your head. It's very fine pinpoints. And what happens is that induces the collagen to reproduce. The collagen is the secret to what happens thereafter. Because with improved collagen, the vaginal tissue tightens, the blood flow increases beneath the vaginal wall. Then now, the vagina is able to produce the lubrication that it used to produce and lead to improved vaginal health. Because of the thickness of the wall that occurs from the increased collagen, that's the reason that there's improvement in urinary incontinence. And because of the self-lubrication that's now occurring, the improved lubrication with sexual intervention, that's the reason you have decreased urinary tract infections. Because now the glycogen is being reproduced inside of the vaginal wall, the pH remains normal again, less yeast infection, less urinary tract infections. This is scientifically proven, this is FDA approved, this is a safe procedure, it's a nearly painless procedure, and it's one that I think you would find would be very beneficial. Women no longer have to suffer silently with something that is very uncomfortable, and this is something that would be a benefit to anyone that might be interested. Now, I'm going to put Patty on the spot.
No, you can.
Because
I was going to talk even if you didn't.
Patty does the procedure, but she also had the procedure done.
Right. And with a little bit of anxiety because it's a laser and typically lasers are uncomfortable. But I can tell you, they had us use a little numbing cream beforehand. but I don't even really feel like I would have needed it. So, and there's 2 areas, you can do the inside and the outside, which we typically do both. So you have pain receptors on the outside for sure, but 2 out of 10 max as far as discomfort. And once you know, every once in a while you're gonna feel just a little zing that has a little heat to it, and it goes right away, and it's no problem at all. As far as the procedure goes, afterward you can have a little blood, and I think that's a good thing that we're getting some healthy tissue moves and things going on down there. So, a little drainage that I had to use a very thin pad for about 24 hours. Soreness, they put an ice pack on right away, and I thought, well, this ice pack is gonna be my friend for the next 48 hours. After it melted once, I took it off and I was perfectly fine to resume normal activity. Now, I think there's a waiting period for sexual activity after the procedure.
Usually 48 hours.
Yeah, so, but anyway, it was very easy for me, and I don't have a lot of the issues that need to be spoken to, but I can tell you that, Brittany, is it 5 weeks ago, 4 weeks ago, that we had our treatment?
Beginning of February, so.
Oh, just, yeah, I'm already, the only thing I can speak to at this point is, less urinary stress incontinence. I just don't notice it as much, I don't have to worry about having a pad there. I still have a little bit, but I have 2 more treatments to go through, so as far as that goes, no problems at all. It's an easy, simple treatment. You're up in the stirrups maybe 15 minutes, maybe more like 10 probably, and it's just easy. And a lot of benefits. And it's not just for people who can't take estrogen. Most of us don't even really want to take estrogen, just for many reasons. It's expensive and for the increased risk of breast cancer, so most of us kind of feel that way. Okay. Any
It's
questions?
done in Bloomsdale?
It is done in Bloomsdale, and Mary, Crecilius, and I are gonna be doing the procedures. We'll do them together at first, but the more we do, you know, our comfort level will increase, so we're ready to go.
Does insurance cover it?
That's a good question, no.
No, insurance doesn't cover the procedure, but the procedure is very affordable when you compare what you're paying for estrogen creams and all the creams that you're having to use.
It's true.
The treatment that's involved with urinary tract infections and everything else. So it's amazingly affordable when you look at the cost of all of that.
How much is it done?
The procedure it's $1,500 for 3 procedures. It's
Or
essentially-
more if you need them.
Yep,
Right.
right,
In a series.
and if you need 4, it's the same cost. You pay
Right.
$1,500 for 3 procedures that you get over the course of, over you get over the course of, 6 weeks, 6 weeks, 6 weeks. And if you need another one, then you've already paid your $1,500 up front, you know. Interestingly, it's a pretty phenomenal machine, and it's hard to imagine that you could have a machine that could do something like this
It's weird.
here in St. Genevieve.
Mhm.
You know, I mean, it's pretty incredible. Most of the machines that you will see that do this, I mean, there's one doctor so far that has it in the city, and he's the only one now. Of course, it's been on the West Coast. If any of you have seen the recent Women's Wives of St. What is it? Housewives in Atlanta. Yeah, Housewives in Atlanta.
Yeah.
One of the ladies on that, they even showed her having the procedure done. I didn't see the show, but I heard about it, you know, and they were talking about it on the show. It's being talked about a lot because it works. It's a good procedure. It's a safe procedure.
There's a website.
RealSelf.com.
Oh, right.
Real
Real
Self.
Self.
Real
RealSelf.
We do it at the clinic in Bloomsdale,
Oh, that.
right off Interstate 55. If you look in your baskets, you'll find, not your baskets, your folders, you'll find there's a Dear Dr. Sharlow, write a question, if you have any specific questions that you may have or may be embarrassed to ask about, just go ahead and write that question. We'll collect the question and someone will be back in touch with you about it, because sometimes there may be questions you have that you don't want to ask, so just go ahead and write it out, and we'll collect that and leave your name and number, and either Brittany or Patty or Mary Crecilius will give you a call to provide the answers for you. Yes, ma'am.
Dr. Sharlow, you may have mentioned it, I might have missed it, but once you have the 3 treatments, 6 weeks apart, then you're good to go for
12 to
2
8,
years,
12 to 18 months, right.
Yeah.
And you need one treatment, not a series of treatments. Generally, it's a maintenance program, and about one treatment every 12 to 18 months that you will need.
One treatment, and how many times is that?
No, one treatment.
And how much does that cost?
We haven't decided on that.
It's
No,
gonna
we
be
haven't
very
determined yet.
affordable, yeah.
But it's probably gonna be, it's gonna be a lot less than what you paid for. It'll be one treatment, and it's not gonna be $1,500 for that treatment. We charge, treatments are $500 a treatment, so it'll probably be around $400 or $500 out.
That's every 12 to 18 months.
Every 12 to 18
When your
months.
symptoms recur, yeah.
A little incontinence, which is just starting with me now.
If you're starting to have urinary incontinence, that's mild, that would be considered
Very
mild in
mild.
the beginning, and this will, yeah, it'll correct it.
But I don't want
What
it to
are
get
the
worse,
risks?
that's what I'm worried
Yeah,
about.
it was
I still
provided.
work.
Sure.
What are the risks?
The risk of this procedure is basically a little discomfort that you might have, a little redness, a little soreness that you may have. There's no risk of infection. There's no risk of cancer. There's no risk of inducing scar. You know, the main risk are the side effects. And the side effects are a little discomfort, a little redness, and a little drainage that you might have initially.
Yeah.
It's a pretty benign procedure.
You don't get put to sleep.
No.
You're right, you don't
need
even need a pain pill, it's that
Okay,
easy.
you don't.
You don't, no, you don't even need a pain
If you've
pill.
had a vaginal speculum examination, that's about where you're starting. It's about like,
But you could take something like naproxen beforehand if you wanted.
you could if you wanted to, you probably will realize after the first time you really didn't need to,
That's true.
but you
Take
could.
aspirin.
I would recommend not taking aspirin. Naproxen would probably be better, and Advil is something. Aspirin could lead to a little bleeding, but, you know, probably not that quick, so if you took an aspirin, it wouldn't hurt. We generally recommend before most of our laser procedures to avoid aspirin, but it probably wouldn't hurt. And as Patty mentioned, we also work on the outside vaginal region because sometimes there's some loss of competence in the tissue around, and that improves the surrounding outside vaginal region. And there is a condition called lichen sclerosis, which is thinning of the skin around the vaginal area that has to be treated with a lot of steroid application. It's thinning of skin, it can bleed, it can lead to what's called vaginal intraepithelial neoplasia. Your gynecologist will tell you if you have that. This also corrects that problem without the need for surgical intervention. You know, but you have to have your gynecologist tell you that's your condition, and they have to assure you that there's no precancerous elements. It is inherently precancerous if it's there for a very long time, but this corrects that problem as well.
And so the laser does go, right over the urethra, the meatus, the opening, and so, that doesn't cause any increased discomfort during the procedure. I will say that for the first 24 hours, I mean, I noticed, you know, when I urinated, but it was not painful, but I could just tell that something had been done in that area. But I would not even have called it pain. I was a little anxious about that part of it, but that was not a problem either.
Anxiety will be very natural after the first, before you've had the first treatment. Naturally, you're gonna have a lot of anxiety because you don't know what to expect. I think you'd be very surprised to find out it was not worth the anxiety, but everyone will experience it for the first time.
How did you say you need to have the gynecologist?
We recommend a gynecological exam within a year prior to having this done. If you've not had one, I'd recommend you should at least get one. However, you will get a vaginal examination, but it's very brief at the time you come. So Patty or Mary Priscillius will do that examination just to make sure that there's no problem there, and it would be safe to have it done.
So if you have that, since the record would be on the St. Genevieve, they would be able to get that off of.
That's right.
those records?
Yes,
Okay.
it'll be on the records that you have. If you're not from St. Genevieve, you know, all you have to do is give us the name of your gynecologist. You know, we have an honor system. You tell us you've seen your gynecologist, we'll trust you. Because you still will have that vaginal examination by the professional that'll do the procedure before it's done.
So the insurance might pay for some of it.
The insurance, there may be some consideration for insurance after 3 procedures if there are things that are being treated such as lichen sclerosis. You know, that is something a little bit different than this actual part of it.
What if you're on a blood thinner?
Probably we ask for you to have that held for a couple of days or so. And, you know, that's not a contraindication to having it done. The people that shouldn't have it done, if you have severe vaginal stenosis, that would require you seeing a gynecologist to have, in order for the machine to be used. If you have active herpes, we recommend you not do it while, if you're active, you'd have to be in an indolent stage where you're not active at that time. If you've had vaginal mesh actually to tag the vaginal wall, not necessarily, the mesh is okay, but we'd have to know exactly where the mesh is before we recommend it. If it's right against the posterior vaginal wall, that's a relative contraindication, but we'd have to know. If you've had radiation therapy to the cervical region or to the uterus, that's not a contraindication. But if you've had pelvic radiation for something more severe that may lead to stenosis or tightening, then that's a relative contraindication, which means you may be able to have it done, but that would require a gynecologist to say it's safe for you to have done. But blood thinners, back to your question, we just ask that you be off it for a couple of days.
And I might also mention too, I think you had talked about this once before, it does involve 3 treatments, and even though you may find you have improvement after the first treatment, you still want to continue with the other 2. And that's why the $1,500 is paid up front to make sure that you get all 3 treatments to get the full benefit of the procedure.
Right, you don't want to shortchange yourself, you really don't. And even though you would, and she's exactly right, the one treatment will provide you with relief, but until you get 3 treatments, you can't really judge the true benefit that you'll get from this treatment. You know, it's like, it's not that we're trying to get more money out of people, it's just that there's only so much energy you can give at one time. You know, you can't overdo it with one treatment. It takes 3 treatments because we know exactly what we're given on each treatment, and it's a very safe administration of energy. Yes, ma'am.
Did you address, I might have missed it, did you address this increases or improves the pH?
Yes, because of glycogen. What happens during vaginal dryness and the loss of the normal lubrication, the pH is off. Don't ask me the exact pH. In other words, we don't measure your pH, we just know it automatically occurs. Glycogen is the product that is produced with vaginal lubrication that maintains a neutral pH that you need.
So it would help with, if you've been treated for vaginal yeast infections for.
Yes. If the vaginal yeast infection is a consequence of vaginal dryness and a consequence of the loss of vaginal competence, yes, absolutely, positively. And this is the whole secret behind it. It just improves lubrication.
You're saying that helps keep vaginal infections away?
Yes, if it's due to vaginal dryness, the loss of the vaginal competence. Yes,
How
exactly.
about the external, or is this kind of embarrassing?
No, it's not embarrassing. It's a good question. We do work the external vaginal region
That
as
skin
well.
out there, vulva, or what do you call that?
The vulva.
It goes away when you get old, it gets all shrunk.
Well, it gets loose, yes, and it just retracts, but no, that's a good question. By this laser does improve the collagen beneath the skin, and you have increased blood flow, and it becomes a lot more viable, and it becomes a lot fuller. It's amazing. It's amazing what it does.
I had the courage to ask, but let me tell you, other people are going to try.
Oh, sure they are.
Oh,
Sure. But that's part of the atrophy, that's part of what occurs. That's what occurs during the aging process. That's what occurs when you lose estrogen. You lose everything, you know, you lose competence. I mean, you get dry and, you know, you just lose the competence of the vaginal mucosa, the lining on the outside. That's part of the aging process. That's part of estrogen, you know, loss. This helps to return you to where you lost it. Well, I appreciate you being here. I hope that if you have any questions that we couldn't answer, write it on the form and we'll get the answers to you. Consultations are private. Consultations generally will be done by me on some occasions, but most of the consultations will be through Patty and through Mary Facilius. So you can sit with both, either of those and talk to them. I'm always available. I appreciate you being here.